Hello, everyone. This is Dr. Hockman, the medical matchmaker, and today we're going to talk about a very important topic when it comes to physician employment, and that is contract negotiation. Now, it's very important to remember that contract negotiations are and should be a two-way street. So let's talk a little bit about why it's essential for both physicians and the employers to really engage in a constructive negotiation. Let's dive in. I'm Dr. Hockman, the medical matchmaker. As a family medicine physician and huge physician advocate, I help doctors to find the jobs of their dreams. As a physician, negotiating the terms of your employment contract are essential not just for you to be able to advocate yourself, but also to get to know your employer a little bit more. It's also an opportunity for employers to really engage and to create the supportive work environment that every physician wants to work in. So getting to know your work environment starts before you've even signed your contract. The negotiation process allows physicians and the employers to really align their expectations. So, as a physician, you're bringing very unique skills, experiences, and preferences to the table. So, it's really important that you clearly communicate your preferences to your employer. And that includes things like compensation, workload, hours, um, benefits, career advancement. All of those are so important to really ensure that you're working towards a good fit between you, the physician, and the employer that you will be working with. Engaging in the negotiation process allows the physician and the employer to foster a mutual respect. It really establishes an open line of communication where both parties can express their needs, their concerns, their priorities. So, what I'm talking about here, in part, is communicating what you need from them, but in addition, truly listening to what they need from you and what they are able to do. What I often see is physicians who say I'd like to be fairly compensated, but not truly understanding what it means to be fairly compensated. And that is something very different between private practice and a hospital or academic employment system. So if you're going to ask for something, know what it is that you're asking for. I also see, some unrealistic expectations just based on what we know and understand as physicians. So if you're able to have that open line of communication, you'll really be able to hear and understand what your employer is saying. And likewise, they should be able to also hear and understand what you're saying and see what they can do to really make those things happen. And not just is that mutually beneficial for both parties, but it really builds a solid foundation of trust and collaboration. Negotiation is not about creating a one side winning at the expense of the other side. It's really about finding the middle ground that would work for both parties, that would be beneficial for both the employer and the employee. If those don't align, it's not going to be a good fit from the start. That being said, if you're given a contract and it's a take it or leave it contract, typically the right answer is to leave it, because if they're not going to negotiate with you at this process when they're still trying to woo you and get you to join their organization, what are they going to be like as an employer, right? Perhaps they are able to explain it in a way that really makes sense. And they say, we came out with our absolute best offer. This is why we're able to offer you this compensation. I'm so sorry. We wish we could come up, but we've come up with a solution. I know that your goal salary would be X. I know this is what you're asking for. While we're not able to do that today, how about we create a structure to help you get there? And that is something that I've seen the practices that I work with doing for the physicians that I help to match them with. And really, when they're able to express that, it really makes the most sense. But your employer should be able to explain to you why they're offering you what they're offering you, and maybe why they're not able to offer what you're asking for. What you're asking for may be realistic for one system, but not another. And so that's where that active listing comes in that we spoke about a little bit earlier. Through negotiation, physicians can ensure that their value and expertise are recognized and compensated fairly and appropriately. And remember, when I say fairly and I say appropriately, that is very different according to the setting. And of course, as you've seen in my other videos, please don't discount the importance of work-life balance, of being valued by your employer, of being a part of the decision-making process, of having a voice. Those are all so important. And when you think about being compensated fairly, remember that you may not be comparing apples to apples. You may be comparing apples to oranges. And so compensated fairly is a very nebulous term. And remember, the word fairly and compensated fairly means very different things according to who you're speaking to and who you're working for, and is not really very well reflected in the MGMA data that we are all looking at. So there's a lot that goes into knowing what fairly means. So when you are advocating for fair compensation, for benefits, for opportunities for growth, and all of these things, that's how we can, as physicians, we can contribute to a more equitable and a more fair healthcare system for all of us, physicians, employers, patients, of course, most importantly. And really, you want an employer that will recognize and value your contributions as a physician. And that makes it more likely to foster a positive and fulfilling work environment. A successful negotiation process sets the stage for a successful employment where you can be there in the long term. Not only do employers want to retain you in the long term, but you as a physician usually are looking for something where you'll be happy and fulfilled and satisfied and want to be there forever. And when physicians feel that they are heard and their needs are met and their concerns are listened to and addressed, we're more likely to be engaged. We're more likely to feel motivated and feel committed to the practice we're working for. And this really ultimately leads to increased job satisfaction, lower burnout rates, lower turnover rates, and improved patient care. By focusing on shared goals and working together, physicians and employers can create a positive and supportive working relationship from the very beginning. And there you have it. When it comes to negotiating the terms of your employment agreement, it's really important to remember that it should be a collaborative effort between the physician and the employer. By aligning our expectations, fostering mutual respect, creating win-win situations, recognizing value, and promoting long-term retention, both physicians and employers can benefit from constructive negotiation. So approach the negotiation process with confidence and open communication and an open mind. Keep your ears open to what your employer is saying and trying to tell you, and really see it from their perspective as well. Because you want to know that that can lead to a rewarding and fulfilling relationship between you and your employer. If you found this video valuable, please go ahead and hit the thumbs up button and of course, subscribe to the channel. Thanks for watching, and I'll see you in my next video.